Assalamu alaikum, good evening, and welcome to another program of Health is Wealth. I am your host, Shabnam Riaz. As always, it's fantastic to be able to share with our viewers all those things related to aspects of health that we feel that can provide you with some awareness and information about things can actually change your lives. Because as we discuss time and time again, in this program, it's the early detection of many diseases and many health issues that actually makes a huge difference to treatment and management of your health. Well, today we have a very important program, and we're going to talk about the importance of early screening to detect bowel and liver cancers. So for today's program, we are very happy to have in our studios Dr. Nadeem Dehami, who is a consultant gastroenterologist. Your special interest is in hepatology and advanced endoscopy. Thank you for joining us.
Thank you for having me.
And seated next to Dr. Nadeem, we have Dr. Ali Zahid, who's a consultant gastroenterologist. Your special interest is in inflammatory bowel disease and bowel cancer. Thank you for being with us.
Thank you.
Okay, before we speak to our guests who are in the studio today, let's have a look at this report.
Liver cancer is the cancer that starts in liver. Cancer which has spread from elsewhere to the liver, known as liver meniscus, is more common than that which starts within the liver. Symptoms of liver cancer may include a lump or pain in the right side below the rib cage, swelling of the abdomen, yellowish skin, easy bruising, weight loss, and weakness. The leading cause of liver cancer is cirrhosis due to hepatitis B, hepatitis C, or alcohol.
Okay, now we hope that you found that informative. Dr. Nadeem, if I can start with you. What is the importance behind screening, and how do we raise its awareness amongst the general public?
Cancer is a huge problem in the world, especially in our society where we have limited access to health resources, and education level in common public about health and the diseases is quite limited. Now, screening is important because in order to prevent cancer, which mostly are detected at an uncurable state. And at that stage, it is incredibly difficult. It is a trauma for a person, it is a trauma for the family. And we have means, we have technology available in this day and age where we can detect most cancers at an early stage. And if we are able to do that, then we are able to offer treatment.
Of course.
And I think that is one of the reasons that we should focus our attention and our resources on screening for cancers, particularly GI cancers, gastroenterology cancers.
Right. And if we're talking about, liver cancer in particular, what is the process there? What is the procedure?
So before I talk about screening for liver cancer, primary liver cancer is quite rare. Liver is it's a unique organ in our body. The reason I call it unique is because most system in our bodies, when there's a disease process in a system, there are symptoms associated with it. Whereas with liver diseases, there are not many symptoms. And therefore it comes to a lot of people as a shock when they're even told about liver disease that they may have. Now, I work abroad, I work in United Kingdom, and majority of my patients and majority of doctors who refer patients to me are quite, they have adequate knowledge at times. But what I have seen over the years that even in West, even in our setup, not many people have an idea about liver diseases. So if I look at from our setup and then compare it to the setup in Pakistan, there's a lot of difference. There's a cultural difference. There's a level of obviously understanding in a common public. So the importance that I would like people to be more aware of is that liver diseases, there are not many symptoms, unlike many other organs in the body.
Right.
So if a disease is not discovered, there is this possibility if that disease is then is left untreated, then there's a risk of significant progression of that disease, and that can eventually cause problems, including cancer. Now in Pakistan, we've got a huge problem of viral hepatitis.
Right.
1 in 5 are, and it is alarming, and it is 1 in 5 people at risk of developing fatty liver disease. 1 in 10 people either have or at risk of viral hepatitis, hepatitis B and C. And there are a number of factors why people develop these viral hepatitis. So I think that will take us another program where we can focus on risk factors for those viral hepatitis. But so there's a huge disease burden in our society. And that disease, because there are not significant symptoms associated, and if it is left untreated, it can lead to the development of scarring in the liver, i.e. cirrhosis in the liver.
Right.
And the symptoms only start from liver diseases when a body stops compensating for the loss of liver functions.
Okay, right. We will, get back to this. Of course, there's so much information that we're going to talk about on liver cancer. Dr. Ali, tell us about bowel cancer. Exactly what are the screening procedures? The difference you find between patients in the East and the West, especially in Pakistan. How many people are really aware as to what this is?
So I think first of all, one has to be very clear as to bowel cancer, what bowel cancer actually means. When we're talking about bowel cancer, we're specifically talking about large intestinal or large bowel cancer, which is actually only the lower last 70 to 80 centimeters of your gut, which actually starts from your all the way from your mouth, esophagus, stomach, small intestine. So this is only a part of the whole system.
Okay.
But even large intestinal cancers are fairly common, both in West as well as in East.
Does dietary habits play
Oh,
a
yeah,
role in it?
Absolutely, absolutely. So there are loose as well as direct correlations with several factors. Lifestyle does play a major role. For example, we've known through studies that red meat, processed meat, they have a direct correlation with etiology or causing the bowel cancer.
So that's valuable information for our viewers, right there.
Absolutely.
Processed foods.
So low fiber diet, red meat, processed food, excess of anything is bad, but excess of these things are specifically bad for bowel cancer. Then, bad lifestyle, being overweight. One would have thought that you are actually more nourished by being obese, but it's the other way around. So you are actually specifically exposing yourself to bad calories, and that does have a correlation with bowel cancer.
Right.
Similarly, lack of exercise. So all these factors do play a role.
So how does the screening process take place? What people, because we don't have these facilities in Pakistan, so how do people make themselves assertive?
Sure. It is a valid concern if people or common population would be worried about bowel cancer, specifically if they have someone who suffered with bowel cancer in the family or with other cancer for that matter. The difference between East and West is a bit more proactive in doing these screenings for all sorts of cancer, but specifically for bowel cancer, which I think 4th or 5th commonest cancer in the West. So what they specifically do, bowel cancer is specifically a cancer of old age or middle age for that matter. So it's more common in people over age 50.
Okay, and right now we're going to show you a report about bowel cancer. So let's have a look.
Colorectal cancer, also known as bowel cancer and colon cancer, is the development of cancer from the colon or rectum. A cancer is the abnormal growth of cells that have the ability to invade or spread to other parts of the body. Signs and symptoms may include blood in stool, a change in bowel movements, weight loss, and feeling tired all the time. Most colorectal cancers are due to the old age and lifestyle factors, with only a small number of cases due to the underlying genetic disorders. Some risk factors include diet, obesity, smoking, and lack of physical activities. Colon growth influences both men and ladies. More than 90% of cases happen in individuals over the age of 50. A colonoscope is a special tool used to perform a colonoscopy. It is a thin, flexible, tubular telescope with a light and video camera that your doctor carefully guides through your colon in order to see and determine the health of your colon.
Okay, welcome back. Dr. Ali, before we went to have a look at that report, we were talking about bowel cancer screening. Who needs it and what is the procedure?
So in West, everyone over age 60 in England, that's where we work, and anyone in Scotland over age 50 until the age of 75, they actually have regular screening. So irrespective of the family risk factors or lifestyle risk factors like we touched upon, they have bowel cancer screening. So that is how common it is, and that is how proactive they are. So the general criteria for bowel cancer screening is everyone would have a test called fecal occult blood on 2 occasions, which is basically checking for amount of red cells or blood cells within the stools. And if it's positive on 2 occasions, then these patients are asked for a direct visualization with the help of a camera test called colonoscopy. So this is a test in which they put a flexible tube with a camera fitted at the end to look at the inside of the large bowel. This by far is the gold standard and the best procedure in terms of absolute exclusion of bowel cancer.
Okay.
There are no tests as good as colonoscopy in excluding it.
And is that something that is determined at that moment?
That's
Or
right.
do you have to take samples?
So
or what?
you basically need screening before this screening colonoscopy. So screening before this screening colonoscopy is fecal occult blood. So you'd have this non-invasive, relatively cheaper test on 2 occasions. And if it's positive on 2 occasions, then they would be asked to come to endoscopy unit in their closer hospital to have a colonoscopy test done. And then, if it's normal, which is the case in majority of the patients, then they would have some sort of follow-up by further fecal occult blood test in a few years' time. So ideally, this is the model which has worked very well for West. Their bowel cancer detection rate has improved significantly, and they've proven through studies that this works. So the key is to be more proactive, to be a bit more vigilant, and sort of understanding of this issue have actually encountered it pretty well. So
Right.
if we were to follow the same model in Pakistan, I think doing colonoscopy or direct camera examination of every patient that you're suspecting of having cancer would obviously be quite challenging. We have very limited endoscopy resources in this country. However, I think fecal occult blood, which is simple stool test, a non-invasive test that everyone can have within the comfort of their houses,
Right.
that is pretty much doable. So if you are worried about bowel cancer or over age 50 and worried about this specific issue, if you have a specific family history, then this is the right test for you as a simple screening test.
Right.
I think it is a test which is readily available in most of the big
And is this something you have done yearly or what
2 yearly.
2 yearly?
That's
okay.
right. And if it is within sort of normal limits, then I think there is no reason to jump to have a camera examination. On the contrary, if you have a family member who is less than age 50 and developed bowel cancer, the first degree relative, not a distant relative, I'm talking about siblings, parents, kids, well, obviously parents and siblings more likely, who have a cancer at that particular age, you are genetically at risk of
I see.
developing bowel
That
cancer.
makes you put you in a high
So
risk.
you can have bowel cancer screening by way of colonoscopy, not fecal occult blood,
Okay.
earlier than 50.
Right.
So
For-
the ideal method would be to speak to a gastroenterologist, a reliable gastroenterologist closer to your residence, and get the colonoscopy on a regular basis. Normally, every 5 years, one colonoscopy would be enough.
Right. So what are the symptoms?
The symptoms can be pretty variable, to be honest. The commonest symptom could be a bit of bloating, so wind in the tummy, change in bowel habits, vague lower abdominal pain, lower tummy pain. If we do the blood test, then they are often found to be anemic, so the blood count can be low.
Okay.
They can also have weight loss. But irrespective of all these symptoms, they can be pretty asymptomatic, so they can have absolutely no symptoms whatsoever. And that's specifically the case in patients who've got right colonic cancer. So colon or large bowel is actually a question mark shaped organ. A bit of it lies on the right hand side. So the ones which are actually on the right hand side can sometimes be without any symptoms. So
I
the
see.
symptoms can be pretty vague
So
or pretty minimal, let's
very,
just say.
very confusing. Okay, so don't change the channel. We'll be right back after this break. Okay, welcome back. Before we were going to the break, we were talking about bowel cancer and screening as well, symptoms too. What about liver cancer screening and sort of briefly the symptoms as well?
So the approach to liver cancer screening is not evidence-based. However, the approach in West is that every patient who has cirrhosis, i.e. scarring of the liver, they undergo ultrasound scan with a blood test every 6 months.
Okay, after every 6 months, right, okay. And the symptoms are, but then you said that this doesn't really carry...
So when a person has a disease, they don't have any symptoms, but if a person develops a cancer, then unfortunately there are lots of symptoms.
Okay, what are those?
So that's when the body stops compensating for the loss of liver function. The liver has got at least 400 functions in our body. A lot of people unfortunately presents with vomiting of blood, significant weight loss. Liver is like a battery in our body. And if the battery runs out, so the secondary batteries in our body are muscles. So what happens, these patients lose weight significantly and very fast. So they appear very emaciated or somebody who's very undernourished. So those are the key things to look for.
Right, okay. Because you and Dr. Ali are here, conducting training for endoscopies and all that, tell us about who exactly needs an endoscopy, and are the frequency with which you find them happening, are they, I mean, is it really something that has to be done on such a...
So as Ali alluded to it earlier, I think the key word there was proactive. So when we have limited resources, so unfortunately the responsibility then lies with the person. So people who are at risk, they should pay more attention to their self. With regards to the liver cancer, the endoscopy indication is we try to look for presence of any abnormal blood channels in the food pipe. And we do it at the onset of diagnosis of a liver scarring, cirrhosis, and then if there's no no veins or abnormal channels present in the food pipe, then they get screened every 3 years. However, if they have any abnormal channel, then they get screened every year. And that's to do with the upper endoscopy of upper GI tract, as we call it. And then I think obviously Ali has already alluded to it, and obviously if he wants to sort of expand more on what he's mentioned earlier.
So with regards to endoscopy, there's a wide array of indications who are doing endoscopy. When we talk about endoscopy as an umbrella term, we are referring to various procedures which are actually within that particular category. The commonest procedures are upper GI endoscopy or gastroscopy, the various names for it. But upper GI endoscopy basically examines the food pipe, stomach and the duodenum, which is the upper part of the small bowel.
Okay.
This is a relatively quick test. The tube that has got a camera fitted at the end is flexible, roughly the thickness of my finger, little finger.
Okay.
And generally the procedure just takes 2 to 3 minutes at most, or sometime combined with the sedation time, 5 minutes.
Are all patients sedated, fully sedated, or what?
It's a procedure which can be done with or without sedation.
Without sedation?
Same is the case with some of the other endoscopic procedures as well. Majority of the patients are a bit apprehensive. They have not had this procedure before. I would be apprehensive if not had endoscopy or knowledge about this procedure before. But generally what I tell my patients is that it's a very commonly done procedure, especially in West. In sort of East as well, in Japan actually, it's a very, very common procedure. And thousands of patients have it every day. It's a procedure without any significant complications. And although it's an invasive test, it's done within safe sort of environment. And generally it's over within 2-3 minutes. Often the patients who've had it and have been a bit apprehensive about it tell me afterwards it wasn't bad at all. So I think that's the main concern from a layman's perspective, that they're a bit worried about having a flexible tube down their throat.
Definitely, I would think it is very sort of
Yeah.
unnerving to.
But it is a very safe test, and if there's a good indication for it, like food getting stuck in the food pipe, unexplained vomiting, weight loss, then this is definitely indicated. Same is the case with the other endoscopic procedures. One of them I already alluded to, which was the colonoscopy or lower GI endoscopy, as we call it. It's a similar procedure, but slightly longer tube and slightly thicker tube, which looks at the whole of the large bowel. But obviously it takes longer because the large bowel is actually more convoluted, more twisted, rather than the food pipe, which is a straight cylindrical pipe. So yeah, that's the long and short about endoscopy.
Okay, right. How do you deal with really nervous patients, and how do you sort of counsel them to?
I think it's all about educating and speaking to a patient. So communication is a key part of our practice. From patient point of view, what I try to tell them that there are no nerve fibers, there are no nerve endings in the bowel itself. So our examination, especially the colonoscopic examination, should not be painful. And there are patients who would have this examination done without any sedation or without any pain relief. So it's all about sort of speaking to the patients, understanding the importance of doing one. So when a person understands why that procedure is indicated, and then obviously when a procedure is explained, each bit is explained, most of people are absolutely fine, and we try to talk them through through the procedure.
Right. Okay. So you know, a person goes in for screening for bowel cancer. They have the colonoscopy, and then you have findings where they are showing positive for cancer. What is the treatment then?
So this is the advantage of doing a screening examination. So if it depends at what stage a cancer is diagnosed. So we don't find cancer in every patient. There are people where we find polyps, which can then turn into a cancer. So a condition or polyp can be found, or even if cancer is found at a stage, you then have to sort of stage it and then take it, depending on the other modalities of investigation available, and then a decision is taken. But then in that decision process, we have to involve our surgical colleagues, our cancer specialists, X-ray specialists. So it's like multi-disciplines coming together to basically put forward a management plan.
Right. Some of the symptoms. Somebody finding blood in their stool. Is that one of the?
Oh yeah, absolutely. In case I missed it, that's one of the common actually symptoms, especially of lower gut cancer or lower colonic or lower large bowel cancers. It's a fairly common symptom. But it's also common other fairly benign common conditions like hemorrhoids, for example.
Right.
So those who've got chronic constipation for a number of months or years and have had intermittent fresh bleeding or spotting from time to time. This might just be piles after all. But I suppose it's always good to be safe than sorry. So if you're worried about these symptoms, it's always a good idea to consult a physician about it.
Right. Okay. So because you both benefit from the fact that you're working abroad, and then you're regularly visiting Pakistan, and you're being able to communicate that knowledge and train people here as well. How what are your real areas of concern where you feel I wish that this thing was being worked upon more in Pakistan in terms of awareness, health
So
awareness?
this is an interesting question. I spoke to a friend of mine who's a consultant psychiatrist in this country, Dr. Shiraz Malik. Now he, when I spoke to him, I think the message that I received is that there's stigma attached to it. So we're not treating patients, we're treating diseases. And I think the message should be loud and clear for the general public. We are treating human beings. We're not treating angels. We're not treating diseases. We're treating those human beings who have this disease process. So that's very important. So it's communication and then psychological aspect of a disease process, which is more important. So people need to be reassured. They need to be engaged in that sort of screening process, as we're talking about. And then once there's a clear understanding, then there's a good chance that general public and people who have or who are at risk of having these diseases will engage with us.
Right. And when you come back to Pakistan and you're able to see patients and treat diseases or train other doctors, what do you find is a common denominator? Is it lifestyle? Is it diet? Is it the lack of awareness? What is contributing more to the disease burden?
If you allow me, I think all these factors are probably very pertinent, to be honest. But what I feel, we have been touching upon the topic of screening quite a lot during this talk. one of the major drawbacks in the current healthcare system in Pakistan is complete lack of primary care, which is actually the filter for picking up serious illnesses.
Right.
The difference between West and East, between mortality, morbidity, which is the outcome, poor prognostic markers and all that, is primarily because the diseases are picked up quite late.
Right.
If you pick up the top 10 killer diseases within Pakistan, you start from ischemic heart disease, which is angina heart disease, hypertension or high blood pressure, diabetes. Maternal mortality rate is very high. Okay, under 5, kids growth stunting is very, very common. Similarly, under 5 mortality is very high. All these issues are primary healthcare issues. Because these issues, these medical problems don't normally present with any symptoms, except when it's actually too late. Patients and general public remain less vigilant about their health. They don't normally present to see a physician, which generally doesn't exist anyway. So you don't normally have a designated primary care physician or a GP for that matter. Normally you see the GP only for common viral illnesses, flu, fever, but you don't normally see them for a screening for these kind of illnesses, which are very common. And as a consequence, when they are missed, or patients often present late, patients present, those who are actually concerned about their health, they have to present to the hospitals, which are actually few and far in between and already overflooded. So if you present with these primary care issues to the hospitals, you can imagine that you will have even lesser time to an already busy and overworked physician.
Right.
So what I think the primary difference between East and West, amongst many problems, one of the major issues in Pakistan is lack of a coordinated and organized primary care system.
Absolutely. Yeah, that's true. Okay, now let's bust some myths, because we're talking about gastroenterology and everything. Ulcers. It's sort of you hear everybody, you hear so many people saying, oh, I've got an ulcer, right? And you're thinking, oh, well, how do you know that? Have you been diagnosed? No, I know I have. So why this, and then the correlation between diet, our type of diet, where we have a lot of oil and spicy food. How much of this is true and how much of this is actually a myth?
GI-related problems, they're multifactorials. There are genetic factors, there are environmental factors, there are clearly the dietary factors. We know the food industry is an industry of trillions. There's a lot of money has gone into it. People would want to produce a cheaper product, good-looking product, tasty products, so people will go and buy it. But it's always a multifactorial problem. It's not just one thing. Now, there can be a number of symptoms. So there are people who would have ulcers, which will cause them a life-threatening problem, i.e. a bleed from either the top or the tail end. There are people who would have ulcer, they will not have many symptoms from it. There's a bug which is known very well in the GI world of H. pylori. Not everyone who has this, at least 1/3 of the world population, especially in the third world, is at risk of that bug. But they don't have any symptoms with it. So people would go and get this bug treated, and their symptoms of reflux will come back. So it will come to a lot of people as a shock. So I think what I would stress here is it's the engagement with as Ali said, with their primary physician is more important, because they're the only people who understand medical side to it. And I think that's where they need to engage with their primary care physicians and make themselves more aware. I think we live in an age of social media, of electronic media, and obviously we have got a lot of internet access. There are many websites available where they've got lots of good information available for it. Say, for example, when I refer a lot of my patients to British Liver Trust website, which is just one word, so BritishLiverTrust.com. It's got everything that a person needs to know about liver disease. Likewise, we can create many of those websites for our general public here. Everybody I can see on the roads have got an iPhone or also a smartphone, and they've got access to it. So if a lot of people have access to it, I think we can sort of try to make sure the knowledge reaches to every person here.
That's right. In that context, I think this is an age of social media. One of the initiatives that we had taken in Britain, having said in Britain, we have got a doctors forum on Facebook, Pakistan Clinical Knowledge, and there were 30,000 doctors both abroad and in Pakistan registered. What we realized was the information, medical information for a layman in Pakistan is not published in Urdu. Most of the time you won't find that pamphlets or leaflets about a disease. Common illnesses, not talking about liver cancer, relatively rare illnesses. Liver cancer, by the way, is not rare. You won't find any sort of leaflets or information about it. So what we did was asked sort of designated specialists to write leaflets in Urdu, and through our website and through links here, what we've done is distributed that in all the major teaching hospitals in sort of North Punjab and even in some of the areas in South Punjab. So that project is actually going quite well. I think this is the need of the hour to give an information, understanding to the patients, so they don't actually have any myths about their illnesses.
That's absolutely true. And as you just mentioned, that is a huge service to people to be able to communicate. Is the media doing its role properly, would you think, in Pakistan, highlighting these things? I mean, because health is one of the major issues that we're dealing with.
The problem is listening to programs like Health at Time can be boring, especially people when they have a busy lifestyles. But I think even our hospital setups, in my opinion, are not doing their bit, which is where the initiative should come from them. I mean, I think this in this part of the world, especially in the North Punjab, I think Holy Family Hospital, especially Professor Umar and his team, I think they've done a huge service, and we visit them quite regularly. We try to run these courses. We try to educate doctors here. It's a knowledge sharing. It's good for us. It's good for our motherland doctors here. We try to give the best we can back to our motherland and doctors here. And I think it's a process which should continue.
Right, okay. So as we were talking about, diagnosis, screening diagnosis, then treatment, we'll deal with the liver cancer treatment and the bowel cancer treatment separately. How long does a treatment go on for, and what are the chances of relapse, and what is the sort of the horizon there?
So regards to bowel cancer, I think with any cancer, the treatment actually lies on what stage you picked it up. Okay, cancer has always had a drastic effect on the person who's got it. When you break the news, it's always a bad news. But the concept is changing. Okay. In West, it's no more an incurable disease, far from it. Okay, so if you pick it up early, especially bowel cancer, there's good hope. So there are 4 stages, A, B, and C. If you pick it up at A, and which is the earliest stage, the chances are nearly 100% that you will recover. If you are a female, if you are a male, then the chances of survival are nearly 90 to 95% at 5 years. So the survival rates are very good. If, on the contrary, if you come at quite a late stage, which is stage D, in which the cancer deposits have gone into the liver and beyond, the chances of surviving are only 5% after 5 years. So you can imagine. So this is again where the primary care role comes in. Screening at an earlier stage, seeing a reliable physician at an earlier stage is the key here. If you pick it up, I'm sure that the disease burden can be reduced.
Right. Dr. Nadeem, the same question to you regarding liver cancer.
So I think I'll start what earlier said. It's dependent on stage, but again, it is a curable problem. It's a curable issue. These days we have access to liver transplants. There are 2 good centers, Sheikh Zayed in Lahore and Shifa Hospital in Islamabad, which are offering transplants to even people who've got liver cancer at an advanced stage. So again, it's not a cancer which is not curable. If it's picked up early, which is where the screening comes into play, it can be cured with localized therapies. They can be given some therapies to burn the area of the cancer. So there are a number of options available, and again, they've got a good survival rates after having it cured. But we've had patients recently who had a liver transplant for a separate problems. When the diseased liver was taken out, 2 sites of liver cancers were picked up.
Yeah.
Now this person was in West and this person was on screening program. So what the emphasis here is that even the screening programs are not perfect.
Right.
It's just that it's important to understand the symptoms can be variable. It's important to be proactive. It's important to take your health in your own hands, try to do your best, and engage with the primary care physicians.
Right. You're involved in charity work here in Pakistan. Tell us a bit about that.
So The project that we've done just now, in fact, we just returned from an endoscopy course, represents a charity called RAHI, which is Ravelian Healthcare Improvement Initiative. So this basically invites qualified medical professionals from overseas, of obviously Pakistani origin, and others as well, to come and provide sort of skills, knowledge, and transfer that skill to the medical trainees in here. So we've done several courses on endoscopy, on several medical specialties, trauma and whatnot, and this is continuing. But the more important charity work that I've done is what we call as World Care Foundation. So this is a sort of relatively decent sized charity that originated from Edinburgh. I had the privilege to be part of it, which started in response to the emerging Syrian crisis in Turkey. So we build orphanages and whatnot. But now we have a lot of volunteers are actually from Pakistan, and a lot of them were doctors. So it wasn't long before we realized that we need to do something in the healthcare. So inshallah, what we're trying to do is establish a healthcare model which provides effective primary care with a central sort of secondary care which provides non-acute hospital services. And we're also introducing sort of concepts like telemedicine, in which a doctor sitting from UK or abroad can actually do conferencing and get involved in the treatment of a patient sitting in Pakistan or in rural suburbs. So our first project is actually being launched in Sheikhupura, and inshallah, hopefully by the end of this year, will be up and running.
That's great, fantastic. Now, because when you're talking about gastroenterology and everything, the main thing you think of is diet and how that affects your health and leads to complications as well. What advice would you have to our viewers for what sort of keeping our culinary tastes in mind as well? We like spicy food. We love our the oil on the food as well. So what are the guidelines there for people to to look after their stomachs as well?
I don't believe there are any guidelines out there. There is information available, but then obviously it has to be individualized. So there's a, I mean, yes, you are right in a way saying that
keeping our sort of culinary needs in mind.
Absolutely, no, it has to be a culture. There's a difference in obviously eating culture is different in Pakistan and compared to the West. There has to be a balance between the input and output. As I said earlier, the liver is like a battery. So you can't overcharge a battery. There are bad fats and good fats. So as long as we are able to burn the calories, as long as, my simple advice to my patients are, just keep an eye on your weight. Okay, just keep an eye on your weight.
That's basically common sense, isn't it? Lots of it is common sense.
That's right. I'll completely second that actually. I think food is not primarily right or wrong. It's the change in lifestyle which has actually been detrimental and causing the...
Okay, how about research? And one day we hear something and we're looking, coffee's good for you or chocolate's good for you, whatever, and then the next day you hear, that has been negated and now you can't have this. And what about all that?
There are certain food elements which are bad, known bad, and there are certain food elements which are good. For example, high fiber diet, containing 5 a day food and fiber, that's absolutely mandatory. And logic suggests that one should have it. And then obviously that there are food components like high fatty foods, probably high spicy as well, but fast food, processed food, like I mentioned, red meat, processed food, they have a role in causing bowel cancer as well as other cancers too. Smoking for many reasons has got bad effects. So all these lifestyle risk factors as well as diets do have some role. But I think at the end of the day, it's a collective picture. It's not just bad food which is causing all that.
Right.
It's a combination of lack of exercise, smoking,
stress as well,
sedentary lifestyle which is causing all that.
I mean, can I just take this opportunity and answer to your earlier question to Ali? I mean, we've also got an organization which is Pakistani Academics Group for Health Education, based primarily in UK and led by two prominent physicians, gastroenterologist and cardiologist, Dr. Ishfaq Ahmed and Dr. Amir Ayub. They have done incredibly well in raising that awareness. managing that workload sort of on a body, as Ali earlier said, there are the leading causes of death, that ischemic heart disease, high blood pressure, diabetes. Diabetes and obesity is also a pandemic in the world. And people who have got these conditions, they're at more risk of developing liver disease, or fatty liver disease. People who have fatty liver disease, they've got a higher risk of dying from cardiovascular mortality or diabetes.
Right.
And it's just maintaining that balance, which can in life can be difficult. There's a lot of advice available. I don't want to overburden. I personally don't want to overburden my patients.
No.
People get overwhelmed. They go to
That's
see
true.
different doctors. Say, look, yes, you know
You
about
start going
science.
crazy thinking
Exactly.
about, you know, the
Yeah.
endless possibilities out there.
Absolutely. You know about science, and the science is not something which people really want to hear. They want to hear how that science can you. What advice can a person have from
How
that?
relevant is it to me,
absolutely.
and what do I need to worry about?
The more confusing aspect is that our science also evolves. For example, recently we found that the 5 a day fiber or fruit is now converted to 10 a day. So in West, we should be having 10 portions of fruit and fiber rather than 5 a day, which is better. Obviously, logic would suggest that's actually better, but that's the current recommendation.
Right.
So it keeps on evolving as well. But I think by and large, the sedentary lifestyle, lack of exercise, obesity, and processed foods, so easy lifestyle, fast food, that's what is leading to a lot of
problems. Okay.
everywhere.
So that's really good advice from our consultants here. Dr. Nadeem and Dr. Ali, thank you very much for taking out your valuable time and spending it here with us in the studios and giving all that valuable information to our viewers. It certainly was a pleasure to speak to you both.
Thank you very much for having us.
Thank you for having us.
Likewise. Okay, so we have come to the end of today's program. Unfortunately, we ran out of time. There were so many other things that we could have spoken about. You know, what the purpose of this program is to bring in experts such as the guests we had today and, you know, to draw from their expertise and their information. And this is all those things that are affecting us on a daily basis, us, our loved ones. And we just need to be assertive and care for ourselves. And so until next week, stay happy, stay healthy. Bye-bye.